A reminder that the herbs need help. Consistency, consistency, consistency. The herbs are not going to do the work if you don't take them regularly. In fact, if you start helping with the herbs and you stop, the body fails to be reassured. And if you then stop, start, the body will sense that the commitment isn't there, that the help isn't going to be consistent, and it may be unhelpful to use the herbs. At the same time, stop the most harmful habits. This includes the sugar, the not exercising, the not drinking water. So harmful habits can be habits that you don't have. The balance to that is to start the helpful actions, and that particularly includes enough water, 7 fruit and vegetables a day, and the essential fatty acids. And the leaflets for the essential fatty acids are on the website, healthandherbs.ie. And there's also a very helpful leaflet on keeping the digestion healthy. So you might find that useful as well. Because along with consistency comes digestion. If there is any problem with the digestion, always deal with that first, or at the very least at the same time as whatever additional complaints you may have, because the digestion is core.
The biggest limitations for herbal medicine are the fact that these answerable questions relate to biomarkers. These are results, test results, things that are visible, things that can be counted. So the level of vitamin D in the body, the influence on liver function tests, the influence on blood cell characteristics. These would all be biochemical markers, and they would show up in blood tests that are done by doctors and sent off to laboratories. By the time you have an influence which is strong enough to consistently have an effect on a biomedical marker, then you have a substance which has a major effect on the physiology. The bigger the effect on the physiology, the greater the potential for side effects. So by the very nature of the healing intervention with herbal medicine, which is to have small subtle changes in your internal biochemistry, it makes it less likely that these will actually show up in the short-term studies with single herbs, which are the domain of most research in herbal medicine. So the other main limiting factor, even if one were to have biomedically influential effects on the body, would be the cost of this kind of research. The smaller the influence, the bigger the study you need to do. And the bigger the study you need to do, the bigger the cost. Those resources just aren't available either from governments or from private industry. I've listed one particular site which has both a free version and a professional subscription version because the scientific evidence that they quote may be useful. Just remember that it is limited to the kinds of information that can be found as a result of scientific inquiry. The term randomized controlled clinical trials refers to looking for evidence to support whether a treatment works better than a placebo. A placebo is a non-active treatment which can't be distinguished from the active treatment, but it's anticipated that it would not have any therapeutic effect. The double-blind part of the description refers to the fact that the medical provider or treatment provider is not aware of which group has the active treatment. Randomization is that the selection for who receives the active and who receives the inactive treatment is chosen entirely by chance or at random.
So hopefully by the time you've finished this course, and well done, there's just one more slide to go, I hope that you will have more resources so that you won't always need to reach for medication for any minor or ongoing medical problem that has been fully investigated. This is not an anti-pharmaceutical pitch. This is really that many mild to moderate alterations of physiology actually are more suitable for herbal medicine to do the job that you want them to do. And if the problems are moderate to severe, you may very well need to combine herbal medicine with medication. but that's probably better under the advice of a consultant medical herbalist. When you think about seeing a medical herbalist, you want to always ask about qualifications, membership of a professional organisation, and insurance. Many herbalists now have degree level qualifications, and that is a robust indication that they have studied anatomy, pharmacology, botany, herbal therapeutics, pharmacy to a good standard of degree level.